Hey guys, today we're going to discuss some of the more common procedures that we do, and we'll kind of do them one at a time. Big time of year for facial rejuvenation, and I really think about facial rejuvenation as a package. You know, a lot of patients will come in and just say, I want to fix the jowl or fix the neck here," and I'll tell them. I mean, we'll listen at first, but I kind of tell people I'm going to look at your face as a package. It doesn't mean we have to do everything, but it's very difficult for me as a surgeon to look at the face and not kind of factor everything in. So I'm going to evaluate what I consider your upper third, your middle third, your lower third, and then the central face, kind of all four components. When I'm looking at the upper face, I'm mainly looking at the brow. The brow is where we want them. Is your forehead too short or too long? And those are going to affect if we recommend a brow lift and how we might do a brow lift. I'll also look at the upper lids. Sometimes they're severe enough hanging down to affect your vision. And sometimes even insurance will cover it, but a lot of us need upper lid blepharoplasties way before it's medically necessary to help us look more refreshed and get fewer comments about need more sleep or more rest. The middle third of the face, we're really going to look at the cheeks. How strong are they? Are they starting to sink? Are we still having some roundness and fullness to the face? And those merge into the lower orbit or the lower eyelid area. And a lot of times that transition gets harsher as the fat kind of bulges in our lower lids and we get a sunken in area along the bone called the tear trough. And then especially if the cheek starts falling, we get a big step off there. And that can be corrected with either sometimes filler, sometimes cheek augmentation. We're using more filler for that rather than implants. And then the lower lid blepharoplasty is usually not just addressing the skin in the lower lid. We're actually addressing that transition zone between the cheek and the lid to smooth things out and make it look younger. Lower third of the face really focuses on the jowls and the neck, and that's typically what's treated, and what surgeons think of as a true facelift is really what we call a lower third facelift, and it's the process of grabbing the deeper structures in the face, a deep structure called the SMAS, superficial musculoepineuritic system, and pulling that up and securing it to the bone or plicating it upon itself will really pull up the jowl and the neck in unison. A lot of times some additional release or platysmoplasty is necessary in the central neck, and we'll do that as part of that lower third facelift. And a lot of times, even despite looking at all that and despite addressing all that surgically, I won't be quite happy unless we do some things to the middle of the face. The very central component of the face that I call the golden triangle is really not affected by a lot of the surgery we do, pulling on the face, working on the cheeks, the lower lids, the upper lids, the brow. So sometimes we address the mouth and the nose area separately. As you age, the nose skin can get longer and kind of plunge down and hang. And a lot of times the upper lip gets longer or gets those fixed vertical lines that some people call smoker's lines. They're not necessarily smoker's lines. They occur anytime you use that muscle a lot, called your orbicularis oris. And as you strengthen that muscle in combination with thinning the skin with age or sun damage, and especially if you lose weight and you lose that little small fatty plane between the skin and the muscle, those vertical lines start to show up, and we may have to address that surgically as well. And then, not to even confuse you more, but a lot of times with facial rejuvenation, you're not doing yourself a favor unless you start treating the skin as well. So a lot of times we'll mix in a little discussion of how you might get your skin ready before surgery or after surgery to kind of help with the actual skin quality, not just what I can surgically control. And that includes lasers and things in the spa. Some of them feel good, some of them hurt a little bit, and we'll kind of walk that through. But my point is, when we see a patient for facial rejuvenation, we cover a lot of things, and we try to do it at a high level and then kind of come in and go back and focus as we do each step. So looking forward to helping you.